Welcome to this walkthrough on how to compose a referral note using the Note Authorship Service powered by GPT-4 Generative AI. In this scenario, we are enabling a clinician to create a referral note for a patient named John Doe who has recurrent episodes of chest pain radiating to the left arm and requires a specialist's attention in cardiology. Before delving into the demo, let's take a brief look at the flow which a clinician can expect to experience. First, we'll review the available information for the identified patient. Then, we will interact with the chat session to compose an initial draft of the cardiology referral note. We will then engage in a back and forth dialogue with GPT. We'll add key pieces of information to get the note to a point where the clinician is comfortable with the contents. The flow concludes with the note being safely and securely stored in the source of record, which could be an electronic medical record, or EMR. Let's begin by reviewing John Doe's available source data. We can do this by selecting this arrow component. After briefly waiting, we will soon see that this is for John Doe displayed in the header. We will also see the introductory chat indicating this is a virtual assistant. This dialogue is shown to promote patient safety while also being clear to the clinician that they are interacting with a virtual assistant. Let's proceed with selecting the first pre-populated prompt. Doing so enables us to see a diagnostic report which shows John underwent an ECG, which revealed T-wave inversions in leads V1 through V4. We also will be seeing a record of a completed stress test with a failed outcome, along with additional details on John Doe's conditions, shown here. Next, we'll draft a referral note. In this example, it will populate answers based on predefined elements pertaining to cardiology. These elements could include details on John's symptoms, medical history, current medications, and any other relevant information. Each of the predefined pieces of information that will soon be displayed are fully configurable and can be centrally governed to meet the specialty needs. We'll see after selecting this component that this is going to be displayed shortly. And here we go, seeing the example of this formatted referral note. But the intelligent assistant goes further by enabling us to add additional information. In this example, let's tell the virtual assistant that the patient is a frequent smoker, 1 pack per day. We can incorporate this information by using a simple prompt. Regenerate note to include PT former smoker, 1 pack per day. You'll see the note that will be displayed in a short time from now will remain the same, but there are now additional pieces of information that will be displayed pertaining to smoking, which is the 1 pack per day. And we can see here that under risk factors, former smoker, 1 pack per day is listed. We have heard that missing information can be a big source of frustration for clinicians and can adversely impact safe and effective patient care. It's why our intelligent assistant also has the capability to assist the clinician to identify any information which may have been missed so that we can better address any gaps in the referral note. And so here we will use that as an example where we can click on this component, review the above referral note if anything is missing. The system will scan through and it will take a look to see if anything is missing so that we can find pieces which we can add. And so in this case here, we can see that there are recommendations that are provided, as well as contact information. We can add contact information based on the feedback provided with the simple prompt. Regenerate note with 555, 555, 5555 in additional information. We will send this in order to be included, and we will see that the smoking information will be included in the regenerated note in addition to the contact details that we just provided. And here we see that the risk factor is included and the telephone number that we have provided is also included. Let's assume that the referral note can be considered complete, at least for now. We can save the latest note's contents after confirming that we wish to save it. We'll go through and show what that looks like. So by clicking on Save the Referral Note, we will see this prompt displayed. And we can save the latest note's contents after confirming Save in this dialog box. Selecting Save can enable the note's contents to be stored in a system that keeps patient records safe and organized. This helps make sure the information is accurate and easy to find in the future. And in this example, we use a format called Fast Healthcare Interoperability Resources, or FHIR, to make it easier to access the data in different systems, like the electronic medical record or EMR. Lastly, we can validate the contents of the message have been stored as reviewed and confirmed by the user. We can do this by checking a simulated data table, which we have set up here, which stores the contents of the message as is. Here, if we hover over top, you'll note that the individual storing the message is also logged in addition to the date and time. By using this note format, we can access patient information quickly and easily, no matter where it is stored. This helps us provide better care to patients like John by enabling care teams to gain a comprehensive view of John's health status. With this comprehensive view, we can enable care teams to make more informed decisions, which can lead to better outcomes for John and other patients. Thank you for watching.